I absolutely think MRD is critical to follow in patients with FLT3-ITD-positive disease and any patient who's NPM1 mutated. And I say that just because many of the NPM1 mutated patients may have a FLT3 TKD, for which we don't have a FLT3 MRD test that we know is valuable. What we know about measurements of FLT3 ITD as MRD is that you have to use a really sensitive assay. You can't just use PCR or standard next-gen sequencing. You need an actual MRD assay. At present, there's only one commercially available MRD assay, the in vivo Scribe one, which we use routinely and was used on the Morpho study with a hope that that would lead to a drug approval. In the end, the study did not meet its primary endpoint, so it couldn't be used as that, but it absolutely was set up so that that could be used as a surrogate endpoint for, in that setting, relapse-free survival, which is probably our most important post-transplant endpoint. I think the key thing now in using MRD is to use that to say who needs what therapy. In the setting of patients going to transplant who have detectable FLT3-ITD either prior to transplant or in any time after the transplant, particularly in the early post-transplant period, there's strong evidence that gilteritinib lowers relapse-free survival, even though that wasn't the primary endpoint from the Morpho study. The other question that we're still trying to figure out is, does everybody with FLT3-ITD need a transplant? And I think we have to be careful about withholding very effective therapy for patients who can really benefit long-term. We see much better survivals in FLT3-ITD-positive AML now than historically, and a lot of that has to do with transplant. So before we're ready to really get rid of it for patients, we have to be sure that's the right thing to do. That being said, there are very provocative data, mostly from the UK, showing that if patients clear MRD early for NPM1 mutation, that they may benefit comparatively little from the transplant, and it may be over treatment. And I think that's probably the direction we're going to go in the future.